Well, next today, the United States is upping its efforts to protect its citizens from the impact of any radiological and nuclear emergencies. The US Health Department is purchasing a drug that treats blood cell injuries caused due to acute radiation syndrome in adults and pediatric patients. The drug, called Nplate, is being purchased from the California-based company called Amgen. Nplate treats acute radiation syndrome, which is also known as radiation sickness. It occurs when a person is exposed to a high dose of penetrating radiation. ARS can lead to uncontrolled and life-threatening bleeding. Nplate is also approved for patients with a blood disorder that results in low platelet counts. Repurposing the drugs for acute radiation syndrome helps to sustain them and their availability. Amgen has developed Nplate along with the Biomedical Advanced Research and Development Authority, a part of the Health and Human Services Department for Strategic Preparedness and Response. The money for purchases of this drug comes from $290 million of designated funding under the Project BioShield. Well, for more on this, we were earlier joined by Dr. Elena Parenyuk, radiobiological expert at the National Academy of Sciences from Zhytomyr in Ukraine.
We need to begin with the fact that it is quite difficult to get the radiation sickness, because even under the nuclear bombing and even in the circumstances when the nuclear power plants are ruined or injured, there will be the emission of the radionuclides in the environment. And even with that emission, the dose rate that is formed by the radionuclides is not enough to cause the severe radiation sickness because of the radionuclides. For example, there were no cases of radiation injury after the Fukushima accident, and there were about 31 cases of radiation injury after Chernobyl. But anyway, talking about the radiation sickness, it looks like there is a source of radiation, like radionuclides, and they emit some particles. Those particles and waves hit human body and ruin the human cells. They are ruining the most vulnerable cells that are multiplying fast. The fastest cells that multiply in our bodies are blood cells in our bone marrow, and also epithelium cells. So basically, the bone marrow is injured, so it cannot create any new blood cells. So some problems with the blood and with the blood flow arises. It is the first step of radiation sickness. Take cover, of course. So the very important thing is that it is necessary to take cover and stay inside. After the radiation emergency, some radionuclides, we are not talking about the nuclear bombing right now, we are talking about any kind of radiation emergency. So if you're not in the epicenter if you're not in the ground zero of the nuclear bombing, you need to take cover, secure the apartment or the office where you live currently in. You should be sure that all of the ventilation, all of the windows are locked, so you are inhaling only the air from the inside. And you should stay in for at least 1 day. And during 1 day, the radionuclide contamination caused by nuclear bombing, for example, will decrease almost 10 times. So the most important is to take cover and be able to stay inside for at least 1 day.